Kathleen from Croakey here at the International Medical Regulation Conference in Melbourne, talking to Kathleen Haley from the Oregon Medical Board in the United States. We've just had a session on what keeps you awake at night, where delegates have been polled about that, and you spoke at it. Can you tell us what keeps you awake at night?
Sure. First of all, it's having the right board members at the table to make the critical decisions they do about the public's health. So are they from diverse backgrounds? Do they have diverse experience? And are they from diverse parts of the state or country in your case? So that's the first thing. The other is that we both have a vision and that we're also focused on the individual patient. So that came about for me because of experience I had in New York with my brother who had cancer and was undergoing treatment. We were moving from the hospital to a non-hospital setting and had a difficult time in Midtown Manhattan getting a taxi until a woman ran from behind us into the middle of traffic and was able to secure a cab for us. It turned out that she was the CEO of Sloan Kettering. So that inspired me.
Where your brother was being treated.
Right. So that really inspired me to realize the importance of not just the bigger vision, but also the individual patient.
Now, a very interesting question came up. There were a lot of issues raised about what keeps people awake, and through the panel discussion too, but there was a question from the audience that we're hearing a lot about worries about putting physicians needlessly through investigations or putting them through the stress of them and the issues of their well-being, but not about the complainant. And the question was, why doesn't that keep you awake at night? What did you think?
Well, I think that it's a day-to-day issue for us, whether we have a complaint from a prisoner or whether we have a complaint from the governor of the state. Either one needs to be looked at very seriously and reviewed, and if necessary sent out for consultation from a specialist in that area. So I see that as ongoing rather than something that particularly keeps me awake at night.
You talked about how you'd had a wake-up call. The board had a wake-up call in terms of dealing with complainant things. Could you describe that?
Yes. Well, 2 months into my position 20-some years ago, we had an OBGYN who had sexually violated over 100 patients, and the board invited all of them to come at their convenience and tell the board their story. Many of the women chose to do so. And from that point forward, when there is an issue of credibility, whether it be sexual misconduct or something else where it's one of these what they call he said, she said, we invite the complainants to come in and tell the board members their story. And we find that's effective.
In what way? What does it do?
Well, they're able to tell what their experience was. I think it's moving to the board members to actually hear the patients face to face.
And it's only issues of credibility.
Yes.
What's that about, and do you think it should be extended more?
I'm not sure that we have the resources to be able to extend it beyond that, but I think that if you're only hearing from the physician, then how do you assess credibility? So in the same way that a jury would hear multiple parties, so too the board needs to do so.
And takeaways from the conference, have you been here for the whole?
Oh, I have. It's been excellent, and I always put stars by issues I want to follow up on, and I have probably a couple dozen, so it's been excellent.
Could you say what one big takeaway is?
One is to do a better job of tracking whether or not our newsletters and our website is really effective. I think we need to, that's the gateway for the public, and we want to be sure that it's really current and relevant for them.
Okay, thank you very much, Kathleen.
I appreciate it. Thanks.